this is Alicia Hartley and my presentation on antisocial personality disorder underneath Dr. Demetria Waddell in Psych 101. So I chose antisocial personality disorder as my project to present because people with these illnesses are not often diagnosed. So they go undiagnosed, they're often in the criminal justice system. And as you can see, the lady here, she is having a hard time, or she's looking at two different faces. She has two different faces in her hand. And one thing that about antisocial personality disorder is that they have a hard time recognizing those social cues when somebody's in pain, when they're hurting, when they are angry, sad, unhappy. And I wanted to know what exactly went wrong that caused them to not be able to pick up on these social cues. One other interesting thing that I'd like to look into further is the conduct disorder in children and how prevalent it is in somebody with antisocial personality disorder, and what helps them not move over to antisocial personality disorder when they hit their later teenage years, or and how, if there is really an intervention that we can do in order to stop these personalities from forming prior to adulthood and maybe staving off some pretty serious events that happen. And I'd also like to research further the link between antisocial personality disorder and substance abuse. So the etymology, is it genetic or situational? There's no one answer as to where the disorder comes from, but there is a few studies out there that show that it does have a genetic cursor, and that coupled with adverse childhood experiences is what leads to the antisocial personality disorder. So if a child's abused, or they've been thrown through the foster system a lot, or maladaptive issues, then they have a higher chance of becoming, having personality disorder of antisocial personality. So what is ASPD? It's a severe personality disorder that exhibits aggression, manipulation, and violent activity, a lack of morality, and no remorse for hurting others. Not all people that have antisocial personality disorder have psychopathy, so not all of them are sociopath or psychopaths, and not all of them end up in the criminal justice system. So your antisocial traits: they're impulsive, and they don't plan things out very well. They exploit others and use manipulation. They're callous in their actions and thoughts towards others and have a dislike for other people. They shift blame a lot. They don't take responsibility for their actions. They're highly confident and grandiose in their demeanor. They're irritable, and they often get into physical fights, so they have impulsive actions. Reckless and disregard for safety of others and themselves. They're irresponsible. They often change jobs. They don't pay back monetary obligations. They have failed relationships. They have a hard time staying monogamous. That's not to say that all cheaters have antisocial personality disorder, and not all antisocial personality disorders will be cheaters. So there is some wiggle room in there. Deceitful. They lie compulsively. They use aliases, and they con others for personal gain. So when we look at the DSM-5, which helps us to not only show different personality disorders, but different mental illnesses like sociopathic personality, your bipolar disorder, ADHD, stuff like that, we use the DSM-5. So in this, the antisocial personality disorder, in order to be diagnosed with it, a person has to exhibit 3 of the 7 precursors prior to the age of 15. And those are failure to conform to laws or social norms, deceitfulness, which is repeated lying, conning others for personal gain, impulsivity, irritability and aggressiveness, so physical fights, They usually get in trouble a lot at school. Reckless disregard for safety for self and others, and a consistent irresponsibility. So they're truant a lot. They don't take care of their stuff. They don't take care of other people's stuff. And they have a lack of remorse. So they're indifferent to having hurt somebody or mistreating somebody. And they often mistreat animals too. So they also have to be 18 years old before they can be diagnosed with antisocial personality disorder. If they exhibit any of these before then, it's called conduct disorder in children. So there was a study done by Simone Pisano et al. And that journal article really focused on conduct disorders in children and psychopathy in children and adolescents. So some of the treatment options that it looked at was cognitive behavior therapy, which helps a person manage their behavior by changing the way they think. It's sometimes used, and sadly, no one treatment has worked this far for somebody with antisocial personality disorder. So I would like to take a look at conduct disorder really quick and see this model of CARES that was recently developed to target children with these callous, unemotional traits. The CARES program ranges from age 3.5 to 8 years old. The reason I want to take a look at it real quick is because conduct disorder in children, you have a 40% chance on a male becoming having an antisocial personality disorder if they exhibit callous, unemotional traits in childhood. And then you also have a 25 to 30% chance of females becoming antisocial, having that personality disorder if they exhibit those callous, unemotional traits. So this is the table that was put into Simone Pisano's journal article, and it shows basically that 3.5 to 8 years old, there's intervention that can be done for the improvement of emotion recognition and labeling, enhancement of prosocial and empathic behaviors, and increase of child's frustration tolerance. So one thing that they did in this study was that they showed that you can actually pick up on children that have higher callous, unemotional traits in their early toddler years. And if we can pick up on that, then we can start these programs earlier in them to help them learn how to manage their emotions, manage their self better, and also be more empathetic. So from 3.5 to 8 years old, you can implement the CARES model. When you go to 6 to 16 years old, they do the emotional retraining. Basically, they enhance that emotion recognition, interpretation, and it improves empathic abilities in the children. And then your adolescents, your mental models, increase positive emotion, reduce negative affect, improvement of decision-making skills, and reduction of psychopathic features. So they do that program for 12 weeks, and what that is geared towards is basically teaching the child there is a better way to handle things. We don't have to get so angry. Let's regulate our emotions. And then we go into the parent programs where parents are taught how to deal with their children. A lot of these children that exhibit callous and emotional traits or conduct disorders in early childhood, if they are handled a lot less harshly, then they have a less chance of having an antisocial personality disorder. And that's because somebody with an antisocial personality disorder, they link somebody, harsh punishment. They see no problem with harsh punishment. So when you give them harsh punishment, then that just reinforces the behavior. So what we want to do is give them positive reinforcement. So again, coaching and rewarding emotional skills, and improves the emotional recognition, improves emotional understanding, teach prosocial and empathic behavior in children, and increase frustration tolerance. And then the ERT, emotional recognition training, psychoeducation of emotions and motivations, so teaching them what emotions are, the motivations behind them, training and regulating their body, emotions, and sensations, and then role playing. Parents play a huge role in helping retrain the brain of the child that is exhibiting these callous and emotional traits. So the next study that I want to take a look at is a recent study by Hoff-Hansel et al. In 2020, and it's the morphology of the criminal brain. And they took 27 violent offenders and 27 controls and studied the brain through MRI while participants were looking at facial expressions. So one thing that you have to look at is there is a necessary condition for all social behavior in the person's ability to make assumptions about the internal and mental state of another person to predict others' feelings, intentions, ideas, and opinions. So we have that ability. We don't always get it right. It's not like ASPD, but at the same time, we have the ability to make assumptions about internal and mental states of another person. Now, what this study concluded is that these social skills are impaired in psychopathic individuals. The ability to make inferences about beliefs and motivations is lacking in antisocial personality disorders. And the gray matter reductions in parts of the brain, like the frontal lobe, the parietal lobe, and the temporal lobe, really play a significant role in this. So when we look at the right superior frontal gyrus, that controls impulse. So we have impulse control issues in somebody that has antisocial personality disorder. And then you have a right middle and superior temporal regions. This is your visual perception of social cues. So in this area, you have a visual perception. If I smile, you're going to know that I'm happy. If I frown, you're going to know I'm sad. Antisocial personality disorders, you'll see that they have a negative correlation. Up here it shows the color chart. And then in the left inferior parietal lobe, which was very interesting, perception of emotions and facial stimuli and interpretation of sensory information. That's where this comes from. And they, again, have a negative correlation. It's pretty much as high as it can get in these areas on these MRI scans. Now, there are some limitations to the study. They only had a small sample group of offenders, and the control group didn't have matching IQ education. So they had a hard time getting people in the general public that still had previous substance abuse like these offenders had. And then the IQ education in the offenders and the control subjects did not match. Another limitation is the small field of MRI research on offenders. There's just not a lot of it out there. But one thing that this study concluded was that behavioral aspects such as antisocial behavior and reactive aggression are linked to gray matter reductions. So in contrast, trait components of psychopathy and aggression, such as emotional detachment and proactive aggression, are not associated with that brain morphology. So that is something to further look into as well. So I have my references here. So you can go and look at those studies yourself if you'd like to. And I thank you guys for taking a look at my slides and my presentation. And I hope you learned a lot about antisocial personality disorder. So a lot more to learn. Thank you and have a wonderful day.